Hello and welcome once again to Intro to Computer Games and Simulations here at Lorain County Community College. I am Mike Substelny, your instructor this term, and we are more than 3/4 of the way through our adventure together, and that means it's time to talk about the health effects of video games, computer games. When we first started the CGSD program and we're setting up all the classes you would have to take to get your degree, and all the different departments weighed in on what was going to happen, the phys ed department said, you know what, there's not any physical education in your curriculum. They can get this degree without any concern for health. So we promised we were going to build some health outcomes into two of the classes, this class and the Serious Games and Simulations class. So this week we're going to talk about health and computer games, and I actually think, since you are all computer game players, there will be some relevance to what we're discussing today, and I think you may enjoy it. All right, there have been some suggestions from numerous sources, I'm not going to try to be comprehensive about it, that all of these things and others might affect the players of computer games. Eye strain, hypertension, carpal tunnel syndrome, lower back strain, obesity, raised aggression, attention deficit disorder, type 2 diabetes, alcoholism, and game addiction. Well, we'll talk about some of these today. When you get to the Serious Games and Simulations class, you will probably be asked to research one of these topics or a topic of your choosing, and write a term paper about what you find scientifically about that. Right now, I'm just going to spend a few minutes on a few of these topics, just to sort of give you an overview and get your mind thinking about it, and there will be a quiz this week about the things I discuss in this class. Okay, first one we'll talk about is eye strain very quickly. A 2002 survey of 1st through 12th graders, 37.7% reported symptoms of eye strain among the players of computer games. This is a paper, Cumulative Trauma Disorder Risk for Children Using Computer Products, by Burke and Pieper. Another one we just mentioned was hypertension. A 2007 study in the American Journal of Hypertension showed a correlation between interactive sedentary behavior, such as computer games, truck driving, things like that, and hypertension. That's high blood pressure and such. Obesity, a 2005 paper, obesity in the Obesity, a research journal, did find a relationship between hours playing computer games and obesity. More hours playing computer games was an indicator of a greater probability of obesity. That is, the names are given there: Earl S. Ford, Harold W. Cole, Ali M. Mokdad, and Umed A. Ajani. If you want to look up that study. I also want to mention computer game addiction, which is sometimes called cyber game addiction syndrome. Computer game addiction, in a 2007 literature review, they described addictive MMORPG games such as World of Warcraft. This was Joe Ahn and George Randall of Clemson University that did this. They used a game addiction questionnaire developed by Dr. Kimberly Young and the Center for Internet Addiction. Here are the 8 questions on that survey. Do you need to play online games with increasing amounts of times in order to achieve the desired excitement? Are you preoccupied with gaming, thinking about it when offline, anticipating your next online session? Have you ever lied to friends and family members to conceal the extent of your online gaming? Do you feel restless and irritable when attempting to cut down or stop your online gaming? That's 4. Number 5, Have you made repeated unsuccessful efforts to control, cut back, or stop your online gaming? Do you use gaming as a way of escaping from problems or relieve feelings of helplessness, guilt, anxiety, or depression? 2 more questions. Have you jeopardized or lost a significant relationship, even risked your marriage because of your online gaming habit? And have you jeopardized a job, educational, or career opportunity because of your online gaming habit? Now, you might think those 8 questions, that doesn't apply to me, but they said answering yes to 1 of those questions. Any of the 8 indicates the possibility of game addiction according to their standards. Let's talk about computer game addiction a little bit more. Those MMORPGs, massive multiplayer online role-playing games, they use many of the tricks employed by Cityville, Farmville. We talked about in, I think that was week 7, about the social games. They use a lot of those same things, such as they rely on interactions with other players. They don't try to build the content into the game. They let the other players provide the content that keeps you coming back by playing with you. And they have no ending. Game like one of the a Final Fantasy game, a game like a Nathan Drake adventure game, they all have an ending. You may be obsessed with playing the game to reach that ending for a period, but then you are satisfied and you're done playing the game, much like possibly watching a film or reading a book. And they use that sunk cost fallacy to keep players coming back. I have already invested this much time in getting that achievement. I can't stop before I get that achievement. Remember the sunk cost fallacy. That turns out to be very strong. In your head, you think that time you've invested would be wasted if you don't keep going. So you end up wasting more time. That's what makes it a fallacy. But researchers ask, is that addiction? And I'm not going to necessarily definitively answer that question here. There's a point that it's not classical addiction. The players are not dependent on the game necessarily the way they are on a drug, alcohol, tobacco product. Pardon me. So if they're not, then what is it? Weimer, Hastings, and Ng say perhaps this MMORPG or even this Cityville or Bejeweled or other Facebook game is the player's only comfortable social medium. If that is the case, then it has to be treated a little differently than the way we would treat a classic addiction. All right, let's talk about another one, carpal tunnel syndrome. This was a really big deal in the 90s because of social changes that were happening, changes that were happening in our society and in our workplace. People started using computers a whole lot. Many Americans started using computers all day, every day in their jobs. And they started noticing this carpal tunnel syndrome popping up. It's a repetitive strain injury, and repetitive strain injuries are caused by repetitive tasks, forceful exertions, vibrations, and sustained awkward positions. It turns out using a computer or a computer game can be repetitive task and a sustained awkward position, as we'll see. So repetitive tasks, lifting things, forceful exertions, lifting heavy things, strange positions that the human body is not supposed to get into. All right, carpal tunnel syndrome is thought to be caused by repetitive use of the fingers on perhaps a computer keyboard or a game controller. Let's talk about the anatomy of the carpal tunnel. A cutaway of the human wrist reveals this tunnel here. These are bones that are going through your arm to your wrist. These are tendons that run from your fingers to the muscles that move your fingers. The muscles that move your fingers are up here in the arm. The muscles that move the fingers are not in the fingers themselves for the most part. So when I flex my fingers, muscles in here are contracting and they're pulling on these tendons. Those tendons are like bicycle brake cables. I think you're all familiar with those. They have a sheath and essentially a cable running through them. It's a living cable that pulls to close your fingers. Then there's this ligament across there. You've got bones along this side of the wrist, and on the inner soft side of the wrist is the transcarpal ligament that goes across there. That holds the wrist together. So you've got the bones, the tendons, that transcarpal ligament, and then there's this thing, this very, very important nerve in the center of that tunnel there. This is called the median nerve. That is a nerve that controls, that detects the sensations in your fingers. And when your fingers touch, feel heat, cold, friction, anything like that, those sensations are sent through that nerve. The problem is show and tell time now. All right, I'm going to go up on the screen with a simulation that I made in Alice. Oops, come on. There's Alice. This is the language we used to teach this class in. When I took this class as a student, we didn't have Game Maker. We had Alice, a 3D language that's still useful for rapid prototyping and teaching object-oriented programming. And here is an animation. Let's say those are tendons. A muscle is pulling the tendon, releasing, pulling the tendon to get the fingers to move. And there is the hand where the fingers are being moved by the pulling of those tendons. You can see pull, contract, extend, relax. All right, when they're pulling there. Now, what happens when, let's see, can we? Yeah, let's bend the wrist into an awkward position like that or like that, and see what happens. If we speed up the animation, we can see those fingers are moving faster and faster. You're playing a computer game, you're typing on your computer. Look at that. That median nerve is turning red. It's getting irritated. What is happening here is there's friction between the sheaths and the bicycle brake cable thing that's going in there. And the more you bend the wrist, the more the friction is. Those things get warm, hot, irritated. They swell in there. As they swell, that poor nerve in there gets crushed. Going back for a minute to our PowerPoint. The nerve in here has only so much space. And if all of those tendons start swelling inside that tunnel, the only thing that can give, there's only so much room in there, the only thing that can give is that nerve. It gets crushed right in there. The thinking is that the human arm, the human wrist, the human fingers evolved over millions of years to be really good at things like climbing a tree, throwing a rock, maybe fashioning a stone knife or something like that. all these really fast actions with the fingers, working on a computer, playing a computer game, playing a piano, things like that. Those are kind of new activities in the human experience. We don't have millions of years of evolution behind that. So it's something that this structure was not intended to do. And we're not prepared for that. We're much better at spending our lives climbing trees than spending our lives working on a computer, is the thinking. So what I will show you, going back to the animation for a moment, is that if you relieve that, if you put your wrist in a neutral position over time, in theory, if you haven't already done too much damage, the swelling will go down. There will be less inflammation, and the irritation in that nerve may subside. Okay, let's talk about carpal tunnel syndrome. Who's inclined to get it? For a long time, it's been known carpenters can get carpal tunnel syndrome. Assembly line workers, also kind of a new thing in the human experience, has not been around for millions of years. Assembly line workers who do the same thing all day, day after day with their hands, can get carpal tunnel syndrome. Electricians have been known to get carpal tunnel syndrome. Truck drivers, driving trucks, has not been around for millions of years. Golfers and gardeners sometimes get carpal tunnel syndrome. And women are up to 3 times more likely to get carpal tunnel syndrome than men. The simple reason is that the carpal tunnel is smaller on a woman, but the irritation of those tendons is just as much, so the swelling can more quickly and more dramatically affect a woman than a man, although a man with a small wrist could be just as susceptible as a woman. And anyone can be susceptible to carpal tunnel syndrome. Now, according to the Cleveland Clinic, their latest publications, and this is still going on, they're saying computer keyboards have not been definitively associated with carpal tunnel syndrome. There is some correlation, but it is not necessarily definitive. This is a big deal. There are lots of occasions where there are lawsuits between employees and employers that they contracted carpal tunnel syndrome, that employees contracted carpal tunnel syndrome while doing their assigned tasks at a computer keyboard at work. Generally, computer game players are doing this voluntarily, so there's not really anyone to sue if you get carpal tunnel syndrome playing your game. And even if you did get it in the workplace, there's kind of, the jury is still out on whether the jury will come in your favor on that one. Now, I am not aware of any study currently linking computer games to carpal tunnel syndrome. Perhaps one of you will do that someday and prove or disprove that there is a link between playing computer games and getting carpal tunnel syndrome. We do notice that video gamers do all of the things that are thought to cause carpal tunnel syndrome. Let's talk about the symptoms. Now that you've heard all about it, here's your chance to think, oh my gosh, as all medical students do. Those symptoms sound like something that happened to me one time. Maybe. Let's find out. Symptoms are pain, tingling, and numbness in the fingers. And it would be the thumb and the 2 closest fingers. Those are the ones that get their sensation through the median nerve. Weakness in the thumb itself. You would feel less able to exert full force with the thumb. You may have a tendency to drop objects. And perhaps the most disturbing and shocking of all is the symptoms are often the very worst at nighttime. Sometimes so painful that it wakes you up and causes you to lose sleep as the wrist relaxes finally after your day's activities. That nerve finally gets to start screaming at you because it is crushed all day long. And all of that at night may cause a loss of sleep. All right, so it affects the thumb, index, and the long finger of your hand. Now, diagnosis, they've got Phelan's test, Tinel's test, electromyography, and x-rays. Phelan's test, I think, has to do with holding your hands in kind of a praying position, bending your wrists like that, and I would go to a professional physical therapist to have them interpret the sensations. I'm not a professional in that field, so I'm not going to try to describe what a carpal tunnel syndrome victim would be feeling. Electromyography is quite effective. If you've ever seen the film The Right Stuff, there's a scene where they insert electrodes into the astronaut candidates' arms and start firing electricity into them and watching their hands react to the electricity. Well, they're testing to see the continuity of the nerve. An electromyography is testing to see, putting an electrical current on the nerve and seeing how it travels through the median nerve. If you have inadequate nerve transmission there, that will show up on the electromyography. And of course, they can do x-rays, other radiological procedures to see if your median nerve has been crushed within the tunnel. Treatment, well, the first line of defense is to wear a brace or a splint to keep your wrist straight while you're doing the activities that can cause carpal tunnel syndrome. If you keep the wrist in the neutral position, that is where the friction is the least going through the carpal tunnel, and so you can move your fingers a lot without having any ill effects, or with reduced ill effects. The more your wrist is bent while you're moving those fingers rapidly, the more likely you are to irritate that nerve. You can take anti-inflammatory drugs, which will reduce the inflammation of those sheaths around your tendons. And you could have surgery. The king of treatments for carpal tunnel syndrome, if all else fails, is a carpal release surgery, where they actually cut the transcarpal ligament to relieve the pressure on there. Kind of a desperate measure. I'm not sure what side effects there are. I certainly don't advocate doing that at home with a razor blade or something. If you believe you have carpal tunnel syndrome, you should consult a medical professional. Okay, that's it for this week. Next week, we're going to talk about game maker scripting for artificial intelligence in your games. We're going to get into some pretty cool, heavy stuff. And until next week, this is Mike Substelny signing off for Intro to Computer Games and Simulations here at Lorain County Community College.